Good morning, students. In this class, we will be starting with the sexually transmitted disease that basically is transmitted by various sexual transmissions. So, today we will be discussing one of the very deadly disease, right, and which is sexually transmitted, that is your syphilis. Syphilis. Now, what is syphilis? Syphilis is a systemic, that means in blood, sexually transmitted disease caused by the organism Tripanima pallidum. It's a bacterium. Tripanima pallidum, it's a spirochete. You know, spiral-shaped bacteria is your spirochete and Tripanima pallidum is a spirochete. The three means of transmission is person-to-person contact via vaginal fluids, anal and oral sexual intercourse, and even through the direct contact with syphilis canker. So the syphilis pustule, if you touch the fluid, then you may have it. Person to person during foreplay, even when there is no penetrative sex, then also the syphilis can be transferred. Pregnant mother can transfer syphilis to the fetus. So syphilis is caused by Tripanima pallidum, which is basically a spirochete. Now the history of syphilis, named from poem published by an Italian physician and poet Girolamo Francescastoro. This is from the name Syphilis, who angered Apollo and was given the disease as a punishment. So you know that there was a conflict, and you know it angered Apollo, and this as a punishment, this particular disease was given. Now, Tripanima pallidum, described in 1905 by Scoudin and Hoffman in cankers and inguinal lymph nodes of the patients. So they have been isolated from the lymph nodes, and cankers, I will show you the cankers, the crusted areas which is being produced by the syphilis lesion in the body. So syphilis introduction, it is caused by Tripanima pallidum, and the transmission is sexual, maternal, fetal, blood transfusion. So even from the blood transfusion they may go. See, this is a spiral-shaped bacterium, and rarely by other means of both transmitting and getting infected with HIV. So rarely it is both, means you get both the disease along with your HIV. Now, spirochetes are long, slender, helically tightly coiled bacteria. Gram-negative, aerobic, it can be aerobic, it requires less oxygen, microaerophilic and anaerobic. Corkscrew motility is there is a corkscrew motility, so it moves like a corkscrew and can be free-living or parasitic. This organism even jumps, right? So it has a power of jumping as well. Best known are those which causes disease, syphilis and Lyme disease. Spiral spirochete, that is mobile of spiral, varies from 4 to 14 length, 5 to 20 microns, and very thin, 0.1 to 0.5 microns. So it is 4 to 14 or 5 to 20 microns. So they are being found in fresh primary lesions and secondary lesion. You will come to know that what are these lesions, what is primary syphilis, what is secondary syphilis, how will you distinguish the lesion, the necrotic areas of primary syphilis and secondary syphilis. This is congenital syphilis. Congenital syphilis usually occurs following vertical transmission, from the mother to the baby. T. pallidum from the infected mother to the fetus in uterus but neonate may also infect during the passage through the birth canal. So during the birth canal, syphilis may happen. Even it may be transferred through the placenta to the fetus. Have axial filament, which is otherwise similar to bacterial flagella. So they have axial filament, which is a locomotory organ. Filaments enable movement of bacteria by rotating in space. So there is a rotational movement of this organism, and they move by rotation. T. pallidum cytoplasm is surrounded by trilaminar cytoplasmic membrane. Peptidoglycan provides rigidity and shape, the cell wall. It has rich lipid membrane layer. 3 to 4 endoflagella is there. Tripanima cannot be cultivated in culture media. The inability to grow most pathogenic triponims in vitro, coupled with the transitory nature of many of the lesions, makes diagnosis of Tripanima interaction impossible. So inability to grow in any culture media, it's not like that, because it grows inside the cell. So you have to have the cell for the growth of the Tripanima. Although Tripanima are distantly related to gram-negative bacteria, they do not stain by Gram's method, and modified staining procedures required. Moreover, the pathogenic Tripanim cannot be cultivated in laboratory media and are maintained in animals. Inactivated in 1 hour, inactivated when in contact with oxygen, soap, distilled water, arsenal, mercurial. So it is very fragile and it can be inactivated very easily. Organism is very fragile, destroyed rapidly by heat, cold and drying. Sexual transmission most common occurs when abrated skin or mucous membrane comes in contact with the pathogen. Can be transferred to fetus. Rare transmission from needle sticks and blood transfusion. So, you know that even HIV is very fragile. It could be easily destroyed. That is why they are basically transferred by intimate contact. Penetration, Tripanima pallidum, enters the body via skin and mucous membrane through abrasion during sexual contact. Also transmitted transplacentally. So, it can be transmitted through placenta. Dissemination, travel via the lymphatic system to region of lymph nodes and then thought throughout the body to the bloodstream. So it through the lymph node throughout the body via bloodstream, and even they invade the central nervous system during any stage of syphilis, and if it is being done, then you cannot be able to save the patient. So today in this class, this is all about syphilis, because we will have a doubt clearing session today. So this is all about the class today. So if you have any question, any comment, please, we will have an interactive class. You may ask question in the interactive